Hi, my name is Dr. Ramkrishna Patel. I'm one of the interventional radiologists with the Vascular Institute at AMI, and today we're going to talk about hemorrhoid artery embolization. Hemorrhoid artery embolization involves going into the arteries using little tiny catheters through a small needle access in the groin to get into the blood vessels that supply the hemorrhoids and shut down the blood flow. So hemorrhoids come in two different classes: internal hemorrhoids, which tend to cause bleeding, and external hemorrhoids, which tend to cause pain. Now, that doesn't mean that one can't cause the other, but that's the typical breakdown. The reason we make that delineation is hemorrhoid artery embolization is most effective for treating internal hemorrhoids, which are typically associated with bleeding. The bleeding oftentimes occurs with bowel movements, but can happen between bowel movements or any time throughout the day. The bleeding can occur sporadically, or it can occur with every bowel movement, depending on the severity of the hemorrhoids. The hemorrhoids are typically diagnosed with a colonoscopy or sigmoidoscopy, but can be seen on physical examination or on imaging. Hemorrhoid artery embolization is the most effective for folks who are having bleeding related to internal hemorrhoids, typically post-bowel movement or during the bowel movement. It can be a small volume of blood just with wiping after having the bowel movement, or it can be bleeding with every bowel movement with blood in the toilet bowl. Varying degrees of bleeding are still treated very effectively with hemorrhoid artery embolization. Lifestyle changes are always a part of treatment when we see someone for a consultation for hemorrhoid artery embolization. One of the most important things is good hydration with adequate water intake, good fiber supplementation with over-the-counter fiber supplements, and good toilet habits, meaning minimizing the amount of time that you spend on the commode, and good bowel hygiene. Compared to other options for internal hemorrhoids, hemorrhoid artery embolization has no post-procedure pain. It is the only form of procedural treatment for internal hemorrhoids that does not have any pain associated post-procedure. An additional benefit of hemorrhoid artery embolization is the route of treatment. The whole procedure is performed transarterially without requiring any transanal or transrectal procedure. Potential risks or complications of hemorrhoid artery embolization are non-target embolization or the possibility of impacting adjacent structures. Fortunately, for hemorrhoid artery embolization, there are no reported cases of non-target embolization that have a significant clinical impact. This is because the arteries that supply the hemorrhoids are easily distinguished from the arteries that supply normal tissues such as the rectum and the anus. So we are very clearly able to see what is a target for us to embolize and what we need to avoid. In preparation for the procedure, we will generally have you start a stool softener 1 or 2 days before the procedure, and frankly that has less to do with the procedure and more to do with the sedation medications. The twilight sedation that we use, those medications do come with a side effect of constipation, and that tends to bother patients more than anything related to the actual hemorrhoid artery embolization. So we have a very regimented protocol of starting stool softeners beforehand, nothing to eat or drink the night before the procedure so we can safely give you the sedation medication. You can typically expect to spend about 4 hours at our facility, 1 hour with pre-procedure, about an hour for the procedure itself when you're under twilight sedation, and then 2 hours recovery when you're waking up from the sedation. Post-procedure recovery is pretty straightforward. You take it easy the rest of the day, meaning you lift nothing heavier than a gallon of milk, and the next morning you're back to normal routine. I always recommend lifelong fiber supplementation and good hydration along with good bowel habits for my patients with hemorrhoids. That helps to prevent any future occurrences of hemorrhoids. Even if we completely treat the ones that are there, you can still form new hemorrhoids if we're not changing the habits that led to the development of the hemorrhoids. According to our experience and the literature, approximately 1/3 of patients may need a second hemorrhoid artery embolization to help get complete control of the symptoms. A lot of that is related to the natural process of our body taking blood supply from adjacent arteries after the initial arteries have been treated. We typically will follow up 1 month, 3 months, 6 months, and a year after the procedure, and approximately 1/3 of patients may have a recurrence of symptoms, in which case they may require a second procedure. Hemorrhoid artery embolization is extremely effective in treating bleeding-related symptoms to internal hemorrhoids. There is certainly always a decrease in the amount of bleeding, with approximately a 70 to 80% complete resolution of symptoms. Suitable candidates for hemorrhoid artery embolization include folks with diagnosed internal hemorrhoids with primary bleeding-related symptoms, we're not interested in getting any transanal or transrectal procedures. I'm Ramkrishna Patel. Thank you for watching, and if you have any further questions, you can reach out to us at vi-ami.com.